If you experience any kind of pain or discomfort, or you start to cramp while you try to lie on your stomach, then your body is trying to tell you that this is no longer a good way for you to sleep. You know, pregnancy does not last forever. I know that you want to get back to sleeping how you are accustomed to, but just give it a little bit, lie on the way that helps you and your baby so that you both can be comfortable throughout the process. Hello moms and dads, and welcome back to Nurse Onyi Teaches. My name is Onyi, and today I will be discussing sleep positions that are recommended in pregnant women. A good number of you have reached out to me via Messenger asking how you should sleep as you grow along in your pregnancy. So I hope that by watching today's video, you find a lot of useful information. If you have not done so already, make sure you hit the subscribe button and then turn on your notification bell, and that's how you know when I upload a video. Now, when a woman first gets pregnant, she can pretty much sleep however she wants. But as you begin to advance along, you need to start taking just some few precautions so that you maximize your body's ability to do certain tasks and you minimize the risk that may be attached, okay? When a woman starts advancing along in her pregnancy, the best position for sleep is left lying, but that's not the only position. Left lying is good even if you are not pregnant because it helps to promote proper blood flow throughout your body. It also helps your kidneys to work very efficiently so that you rid yourself of waste and other things that are not good for your body. Now imagine how much more important for you to lie on your left when you are pregnant. When you become pregnant, your body is doing double function to remove waste for your baby and for yourself also. So when you sleep on your left side, you thoroughly support your body's ability to filter blood effectively and for your baby to remove waste from the placenta and out into your bloodstream to get it out of your body. The next position that you can sleep in is sitting up, propped up with pillows. As a lot of women begin to find out in their pregnancy journey, sometimes you deal with acid reflux, right? Well, if you lie down while you are dealing with reflux, that churning will come rushing up your esophagus or your throat, and it can just cause you to be so uncomfortable while you are trying to sleep. So if you are having a hard time sleeping because of acid reflux, you can just sit up, angle yourself down comfortably and put some pillows around you to help make sure that you are as comfortable as possible. Sitting up with a pillow also helps to ease your breathing as you become heavy. The more reclined you are when you are pregnant, especially if you're in your second or third trimester, the more your uterus falls backwards and kind of puts a lot of weight on your lungs. You have a diaphragm in your abdomen that has to go down to allow your lungs to fill up with air and then comes back up when you exhale or breathe out. With a very pregnant uterus in the way, you find it a lot more difficult for that diaphragm to contract and relax as you breathe. So most women find that it's easier for them to just sit up, and this helps them as they are getting, bigger and larger along in their pregnancy journey. Another position that a lot of women find comfortable is lying on their stomach. Now, like I said, when you are first pregnant, you can lie on your stomach. Some women have no problem lying on their stomach for, all of their first trimester, and a lot of women well into their second trimester. But for many women, as you begin to show, it makes it a little bit more uncomfortable, even painful at times, for you to lie on your stomach. So be careful with that. If you experience any kind of pain or discomfort, or you start to cramp while you try to lie on your stomach, then your body is trying to tell you that this is no longer a good way for you to sleep. Pregnancy does not last forever. I know that you want to get back to sleeping how you are accustomed to, but just give it a little bit, lie on the way that helps you and your baby so that you both can be comfortable throughout the process. Now, last but certainly not least, and very important, a lot of women have asked if it is okay for them to lie directly on their back. In the beginning parts of your pregnancy, as I have previously stated, you can sleep however you want. You can sleep belly, back, side. But as your uterus begins to grow out of your pelvis in the second and the third trimester, it becomes a little bit more tricky for you to lie on your back, because when you lie on your back, your pregnant uterus puts pressure on some very important blood vessels that should not be compressed during pregnancy. And when these blood vessels become compressed, fresh oxygen does not flow readily to organ systems that lie below it, nor is your body capable of filtering and removing all the waste products from the part that needs to flow back up to get removed from the body. If you think about it, when a blood vessel is compressed, it can lead to hypotension, which means that if a woman gets up too quickly, following lying directly on her back, she can become very dizzy. She can even fall out. Also, your body is not removing a lot of waste products as effectively as it could if you were lying in another position, say to your left or to your right. Another issue with lying on your back is that not only is it hindering your blood flow, it's also restricting the amount of blood flow that your baby and your uterus is getting. So it can just, cause a lot of some negative outcomes for the poor baby. So make sure you consider this. Now, if a woman is lying down on her side and during the night she just rolls over and can't help it, and she wakes up and she finds herself lying on her back, there's nothing you can do about that. Most you can do is just change position and get in a more comfortable way of sleeping or a more recommended way of sleeping and give your body some time to shift your blood flow before you get up. If you ever find yourself where you feel dizzy or you feel like you're gonna fall, make sure you sit on the edge of the bed. Give yourself a few minutes to catch your breath before you go ahead and get up. It's also important to keep a little water on the side of the bed just in case, the hypertension drops a little too low. Grab something and drink. You expand the amount of blood in your body and you give your body a bit more opportunity to catch your breath. Also, while I'm speaking about breath, you can take a few deep breaths to help bring some nice fresh oxygen to all those blood vessels and help you in the recovery process. Now, if you have any more questions, I welcome you to put them in the comment section and I will address them to the best of my abilities if it lines up with my practice rights. Now, if you have learned something from the content of this video, and I truly hope that you have, make sure you hit the subscribe button and turn on your notification bell. And then make sure you share this video with somebody who you know can benefit from it. This is how we build a community of learners so that no women or men are left out there looking for information uncertain of what is fact and what is, fiction. By sharing these videos, you get the word out there so that more people are educated and can be informed forces on their own pregnancy journey. I wish you the best. I hope you have a safe, healthy, and happy pregnancy. And until the next time, be blessed.